Well, pregnancy can come with a lot of questions and a lot of unknowns, especially right now. Lately, many pregnant women are wondering whether they should get the COVID-19 vaccine.
That's why Fox 12's Haley Rush sat down with two healthcare professionals to get the answers for you.
Initially, I thought this was something that I wasn't going to get.
Laura Bird is a little over 30 weeks pregnant and just received her second dose of the COVID-19 vaccine.
When the vaccine became available and I got that pop-up that said that I could schedule an appointment, I probably scheduled and rescheduled the appointment 3 times.
Working as an occupational therapist and home health care provider, Bird has seen some of the devastating effects of COVID firsthand.
Even after people return home, oxygen dependent, unable to engage in their normal occupations.
Bird says her chances of being exposed to COVID is also high. Plus, her husband works in healthcare too.
And that was, for me, I kind of realized that I wasn't just facing my own risk. I was facing the risk my husband was bringing home, as well as my son is in full-time in-person daycare. And that despite our best efforts, that the vaccine is something that could protect myself and my new kiddos.
Is there a current recommendation for pregnant women and the vaccine?
So the American College of Obstetrics and Gynecology recommend that the COVID-19 mRNA vaccine should not be withheld from pregnant or breastfeeding women.
Dr. Amy Hermish is a maternal fetal medicine physician and medical director of the Labor and Delivery Unit at OHSU and Hillsborough Medical Center.
Do we know much about pregnant women in the vaccine right now?
We do have some information. The clinical trials for the COVID-19 vaccine did not initially include pregnant women, although there's no scientific reason that we would suspect that an mRNA vaccine wouldn't be safe in pregnancy.
Dr. Hermish says several women in the trial did become pregnant shortly before or after receiving the vaccine, and so far no problems have been reported. She says there have been tests on animals as well that are reassuring.
I think what's really important to also point out is that pregnant women are at higher risk of complications from COVID-19 compared to other women who are the same age and the same risk factors. They're at higher risk of intensive care unit admission, needing ventilation support, and even a small increased risk in death. So these complications also affect the baby. So it's important to consider those risks when comparing some of the unknown things about the vaccine.
And Bird says weighing those risks helped make her decision.
It was a pretty agonizing decision to make it, but I have to say once I've gotten the vaccine, I've had no concerns. I've had no issues, and I was more than excited to get my second dose, and the idea that in 2 weeks I'll be likely over 90% protected.
Haley Rush, Fox 12 Oregon.